Hello, I'm Emma Howard and I'm joined by Dr Su Laurent, who's a consultant paediatrician at Barnet Hospital in Hertfordshire. Hello, Sue.
Hello, Emma.
Got a question here about an 11-year-old girl. Her mum says she has such bad headaches that she's missed a lot of school this term. My doctor says she doesn't need a scan, but I'm becoming increasingly worried about her. So what do you think the signs are that this girl's having bad headaches?
Well, headaches are really, really common and they're really worrying for parents. And obviously at 11 she'll be telling her mum she's having headaches and often looking like she's in pain, and she may look rather pale. And it's important really that you do see a doctor and get your child checked out if they're getting regular headaches, because there are important things that doctors can do just by looking that should be reassuring. And one of the things that we do is we take a child's blood pressure, we look at the back of the eyes, and these are signs to try and eliminate what we call raised intracranial pressure. That's raised pressure in the brain causing headaches. Very unusual, but if you get signs, abnormalities of these things, then you'd be more likely to do a scan. We also test a child's coordination when they have headaches, because if a child's got something like a brain tumour, which is always in the back of every parent's mind.
Yes, the ultimate fear.
Exactly. One of the common things that happens first is that they get poor coordination. So that's one of the important things that we look at. And most children with headaches don't have a brain tumour, don't have a problem in their brain that's causing a headache, but many parents are very, very anxious.
So this woman should be reassured if her doctor's saying she doesn't need a scan. He's done those tests, he's not worried.
But parental anxiety can make a child's headaches carry on, because if a parent's anxious, a child's anxious, and if this mother's still very worried, she's perfectly entitled to ask for a second opinion from a paediatrician, who may well go through the same tests again. And I must say, I find sometimes as a paediatrician, I find myself ordering a scan because parents are so worried, and I know the scan is going to be normal. But sometimes we just can't move on until we know that everyone knows that scan is normal.
Which is helpful for the parent and then ultimately helpful for the child.
And most parents don't want scans, but just sometimes if they're so fixated, and sometimes there's a family reason, a family history reason, that we sometimes end up doing a scan.
Yes, and ultimately will produce the effect that you want, but you're only going to get it if you really reassure them.
But several steps backward, just an important thing to say is that many of us have headaches because we're a little bit dehydrated. And lots of school-age children
don't drink enough water.
I'm always saying this. So, and finally, most headaches are actually due to a level of anxiety. So it's trying to unravel what's going on at school or what's going on at home, which could be making this child have headaches.
Sue, thank you very much for that. If you have a similar problem, we hope we might have given you some help. But remember, it's always best to go and see your own doctor for medical advice. Thanks for watching. We'll be back with more health questions and answers.